you will be very relieved to know I'm not going to walk you through the 47 recommendations or so that I made, but I want to draw 5 what I think are very important enduring lessons. 1, the universal single-payer advantage. I want to underline and reinforce the advantages of the single-payer system for the reasons that I've advanced. Our task is not free of difficulties, but if it's as good as I argue the evidence shows, then what we should be doing is bringing aspects of home care, access to advanced diagnostics, at least catastrophic drug coverage on other areas of fast rising costs outside the system into the single-payer system. Point number 2, let's focus on total costs. Our concern here should be to control total health costs and to avoid shifting expenditures between public and private sectors. 3rd, wait times. Clearly, wait times and timeliness of them is a big issue. While the vast majority of Canadians who actually have come into contact with health care say that they have a very strong and positive impression about it, we got to admit that wait times have really now dominated the news. Complaints about access, especially to some forms of surgery, specialists, and advanced diagnostics, have become very commonplace. I'll give you my own view. So commonplace and have occupied so much of the media's attention that I think it has skewered the proper and comprehensive debate on health care. Moreover, our policy responses to this pressure to wait times recently, responses which concentrate on 5 areas, cardiac, cancer, as important as they are, hip, knee, and one other one I forget. These emphasis on 5 have a knockoff effect or a reverberating effect throughout the entire system, both in hospitals and the delivery of health care. What's needed is a comprehensive strategy. 4th, the determinants of health. We haven't paid enough attention to determinants of health at all. This is a shortcoming of our debate. The Change Foundation, I hope, will look at this thing. And finally, transformative change. We need governments and people at all levels in the healthcare system to show the will and the determination that they're going to tackle transformative change. Emphasis on quality of healthcare. Again, Dr. Rackless and others have spoken about this. The seamless system that I alluded to, breaking down the silos. This is the step that would be greatly welcomed by the public, and I think is encapsulated in Ontario's efforts to reform the system by this process of integration. A long way to go yet, even with its ups and downs. I trust that the Change Foundation will contribute its efforts to ensure that your province really achieves truly transformative changes, and it's going to take guts, in good old simple old-fashioned English, guts and determination to make sure that the effective changes and the traditions are broken down to achieve it.